And we saw the news break a few days back, and we broke it first on Republic about the nasal vaccine. Now, you've been talking about it. I remember, I think it was 2020, one of the first interviews, 2021, the first interview to Arnab, when you spoke to him, you hinted at this nasal vaccine, and you spoke about how this is going to be a game changer. And since then, I think the progress has been steady, and it's gone into the third phase of trials, if I'm not wrong. And which will effectively mean that it will be approved as booster soon, hopefully. What is your take on that? Now, how far are we, or how close are we to a nasal vaccine booster?
I think we're very close, Niranjan. What we are doing is, I said in the beginning also that to understand the immunology was very complex for Nasal. Many trials failed globally. That was scaring us. And now we understood why our Nasal works better. So that, I'll keep it separate, but the immunology of it, I don't want to confuse the audience. But certainly we figured out the immunology. So we did the 2 phase 2 trials to find out how this immunology works. We figured out, now we asked the CDSO, and they're giving a permission to 2 phase 3 trials. 1 phase 3 as a booster, another phase 3 for a heterotyping, like Covaxin first dose, second dose will be nasal.
Yeah.
And the other one is a booster with a Covishield and Covaxin. Both will be given a booster dose and see how it is performing. And I think it looks like it's going to be reality. As long as adverse reactions are not there, safety is proven, and we are now confident about immunology, and we are sure about that.
I'm going to stick to this point of the nasal vaccine. Now, we've been hearing about how the subject expert committee of India's drug authority is set to meet, and they're examining your application, of course, for the 3rd dose. Now, do you think this nasal vaccine is going to be an effective booster? How is it going to be a game changer? I want you to talk about it in detail.
There are 2 important things. Anybody for COVID, you love to have, important is IgA response. Apple, IgA. There are 2 responses, IgA and IgG. And 3rd response, T cell response. You would prefer all 3 in a vaccine. And the nasal gives all 3. Injectable gives only IgG and T cell response. Whereas nasal gives IgA and IgG. And IgA is a very important, it's a broad spectrum and immunity. And that's protected all the nasal area. Mucosal means, like imagine you have a skin.
Yeah.
The same skin inside the nostril is called mucosal, we call. Up to intestine is called, instead of skin outside, inside the skin, we call as a mucosal. That is where the virus gets start attacking. And if you have immune response right there, the gate of entry is blocked. So you have this is a respiratory pathogen. It gets into the nose or mouth, whatever it is. When it gets in, you have all the immunity systems are locked up here, and it immediately acts on the virus not to multiply, so that you're stopping the transmission. And most important, we need to stop the transmission of the virus. So all injectable vaccine, you look at US, all injectable vaccine, US, Denmark, everybody's got highest coverage of vaccination, particularly Denmark and all. Israel has got almost 97% vaccinated, but still getting a disease and still getting a transmission. So that transmission, you want to block it. I think nasal is the one key aspect of it. And also, look at a country of 1.3 billion. We can easily deliver, and only 1 dose. You don't need a 2 dose. The people who are vaccinated, you give 1 dose drop, 4 drops on nasal, you're done with it. And we have seen some of the results are extremely good. And I think we'll be soon publishing the data.
And this is only going to be a booster, right? This is going to be a booster for now.
No, we are looking at both the heterotypic and the booster. One trial booster. The other aspect is we give Covaxin first dose, or Covishield. Anybody has taken Covishield, doesn't matter, and give a 2nd dose as a nasal.